Starting our new series of extended matching questions. Here the first question for necrotizing enterocolitis. It says risk factors for NEC or necrotizing enterocolitis, and he gives you many options and you can choose one or more or none. First is breast milk, formula feeds, non-human milk, congenital cardiac anomalies, either the baby had an anomaly or had a bypass operation, the midgut volvulus, the male gender, the jejunal atresia, the TPN, and the meconium peritonitis. Is it a risk factor for necrotizing enterocolitis or not? And the congenital hip dislocation. Of course it's not, but we'll see. The first card is the options, and then we'll give now the questions. Two clinical scenarios. He says choose which one is mostly associated with NEC in the following scenarios. The first scenario I write with you in order to be concentrating in the two scenarios. A 3 weeks old baby born at 28 weeks gestational age and weighing 1.2 kilograms. Which of the following are risk factors? And the second scenario is a 1 week old breastfed and he is term with normal weight and normal gestational age, normal weight for gestational age. So when we look at the options and we have to choose from this, you can choose either one or more or not at all. So the answer is for a 3 week baby, 28 weeks gestational age and 1200 grams in weight, the answer will be number B, which is the formula feeds. And for the other question or clinical scenario, a 1 week breastfed but he is full term, normal weight for gestational age, the only option for this to have a necrotizing enterocolitis is the congenital cardiac anomalies or C. So the answer will be 1 for B and 2 for C. So let's discuss why are these two scenarios have the answers of B and C. First, we can see that the necrotizing enterocolitis is a very rare disease in the full term, but it's not rare in the all live birth. In the live birth it's 1%, and it can be as high as 7%, especially with the very low birth weight infants. So the very low birth weight is a risk factor, is a recognized risk factor, but the gender has no predilection, and the prematurity has as the low birth weight very high risk. That we can see that in about 90% of the cases of the necrotizing enterocolitis, the prematurity is 90% of these cases. Okay, but there is no gender predilection, so this is not right. Mid-gut volvulus has no relation to the necrotizing enterocolitis. Also, vaginal atresia is a separate entity, and TPN. Those in orange are outside. But these three have another comment. The formula has a risk factor, while the breast milk has from 3 to 10 reduction in the risk. So the overall mortality of the necrotizing enterocolitis, for your information, is about 15 up to maximum 30, and is significantly higher up to 50 in babies who undergo the surgery and have a high risk factor of Bell 2 or 3. Surgical intervention is needed usually in 20 to 40% of the patients, and the circulatory and ischemic changes can occur in babies who had bypass or who had cardiac anomalies. That's why we chose for the full-term baby the cardiac anomaly. While in the preterm, it's the norm. It's in 90% of the necrotizing enterocolitis, they are preterm and low weight for the gestational age. So we chose the formula, of course, not the breast, because the human milk has a 3 to 10 fold reduction in the risk. So to sum up all of this, we can see that the prematurity is present in more than 90% of the cases, and there is no gender predilection, and the occurrence of necrotizing enterocolitis in the patients who have never been fed is very rare, but if they are fed with formula milk, it has a high risk, and 10-fold reduction in risk if it's human breast milk. And we talked about the overall mortality and the surgery indication in about third of cases. And in the term, babies we choose, or the author choose, the cardiac anomalies or the bypass surgeries, which give an impact on the enteric circulation. Thank you, and see you inshallah in the new question.